We know that many types of care are shifting away from traditional settings like hospitals and physician offices, but what specifically is shifting and how? The larger site of care shift movement is composed of 5 key shifts: surgical care, diagnostics, convenient care, digital health, and home-based care. In terms of revenue, the largest shift taking place today is in surgical care. This entails surgeries moving away from hospitals' inpatient setting, which requires an overnight stay, to an outpatient setting, like an ambulatory surgery center. The most common outpatient settings for surgery include hospital outpatient departments, or HOPDs, which are still located on a hospital's campus, and ambulatory surgery centers, or ASCs, which are located off a hospital's campus, typically in a more convenient freestanding building. The pace at which a particular surgery shifts settings depends on several factors, including how complex it is and whether payers will reimburse it in the outpatient setting. In the past, most surgeries were not considered safe to be performed outside the hospital. But today, many surgeries no longer require clinical supervision of a hospital, and innovations in clinical technology have made them safer to perform at alternative sites. For example, laser-assisted cataract surgery is now commonly carried out in ASCs. With laser technology, incisions are more accurate, making the procedure far lower risk and the recovery faster than it was when safety concerns confined it to the hospital. The shift away from the hospital setting not only makes surgery more convenient, but also less expensive, since most surgeries cost far less when delivered in an outpatient setting. This is a win for patients and payers alike. The second major site of care shift happening today is the diagnostic services shift. Diagnostic services are tests and procedures that help providers diagnose a patient's condition. In the past, these services were primarily performed in a hospital setting, but now they are increasingly performed in freestanding imaging centers or physician offices. Diagnostic services can include laboratory tests, such as blood work, or imaging services, such as X-rays or MRIs. For instance, when a patient comes in with lower back pain, ordering an MRI can help a doctor quickly determine that the cause of the pain is, say, a herniated disc. Like other shifts, the diagnostic services shift can lower costs and increase convenience for patients. Freestanding diagnostic sites typically bill at much lower rates than hospitals and are located in areas that are more accessible to the patient. The third major shift is the convenient care shift. This shift moves low acuity care from traditional sites like hospitals and physician offices to more convenient locations like urgent or retail care sites. For example, instead of going to the ER for minor injuries, a patient can go to an urgent care center. Instead of seeing a primary care doctor for vaccinations, they can turn to a retail clinic. In these alternative settings, patients don't usually need an appointment or have to wait as long to see a clinician. Consider Rhea, who got her latest flu shot at a retail clinic. She happened to need a few things from the store, and upon seeing a sign advertising flu shots, decided to get her immunization at the same time. She didn't need an appointment with her primary care physician and was able to seamlessly fit her care into the rest of her day. There's no question, this shift also means more convenient care for patients, closer to home and at a lower cost. The next shift could not have come about without a range of new technologies to support care, the digital health shift. The digital health shift is the transfer of physician visits and other low acuity care from brick-and-mortar sites to digital platforms. Digital health includes everything from telehealth to remote patient monitoring through wearables. This shift is happening not only at hospitals, but also at physicians' offices and even convenient care sites. Digital care delivery can happen both synchronously and asynchronously. When a patient and provider connect at the same time, such as in a video appointment, it's called synchronous care. When a patient and provider message at separate times, that's called asynchronous care. Prior to the COVID-19 pandemic, a relatively small number of patients had tried telehealth, but post-pandemic, most Americans have tried it. In one study, 94% of patients said they would do it again. Key benefits include minimal wait time, less travel, and eliminating the need for childcare among parents and guardians. The greatest shifts are expected to be seen in psychiatry services, pre- and post-operative care, dermatology services, and pediatric services. However, long-term adoption of digital health will depend heavily on reimbursement policy decisions from Medicare and consistent proof of positive clinical outcomes. The fifth and final shift is to home-based care. Home-based care is a term used to describe any care that is provided in a person's home instead of a healthcare facility. The shift involves replacing things like acute care, post-acute care, and hospice care with in-home services. Infusion and dialysis services have the greatest potential to shift, but many other types of care are shifting as well. One example is called acute care at home, sometimes called hospital at home. That is, providing care at home when it is safe to do so for patients who would otherwise be admitted to a hospital. This can include visits from a nurse, home-based medication administration, and portable x-rays. Common conditions treated through acute care at home include pneumonia and congestive heart failure. While home-based care can be utilized by a variety of patient types, the most common demographic is older individuals who need chronic care management that can be more easily administered in the home and who often have trouble leaving the home. Beyond higher convenience and often lower costs, a key benefit of the home-based care shift is a reduced risk of hospital-acquired infections. A potential downside, however, is the shift of caregiver responsibilities onto non-caregivers, such as family members or friends. That said, it is still unclear how much of an additional burden this shift adds, as compared to the same patients being treated in the hospital. Like digital health, long-term adoption of home-based care will largely depend on reimbursement prospects and consistent proof of positive clinical outcomes. These 5 site-of-care shifts are not all new, but they have accelerated rapidly in recent years. Drivers of shifts such as payment and regulatory changes and payer, patient, and provider preferences are reshaping healthcare as we know it. At the precipice of these changes, understanding the dynamics of site-of-care shifts will be key to navigating them successfully.